Hi, have you ever wanted to help someone who was really sick? Well, you can, and you can help by donating blood. By the end of this speech, I hope that you will be motivated to go donate. The first thing that I'll be discussing today is how it will help others. The second is how it will help you. And then lastly, we're going to talk about some concerns and the process of donating. When you donate blood, they can use it for many things. One of the first things that they use in your blood is the red blood cells. The red blood cells are normally used to help cancer patients, but they're also used to help people who have blood diseases as well as treating anemia, transplants, and burn victims. The plasma in your blood can also be used. It provides proteins and nutrients and is also used to help with clotting treatments. The platelets in your blood are small, tiny cells that they pull and normally are used to help people who have high risk of bleeding, as well as it can help repair body tissues. Sorry. By donating, you can save 3 lives just by donating once. 1 in 7 people that will be hospitalized are going to need a transfusion. Every 2 seconds, they need blood. 38% of Americans can donate blood, but choose not to for some reason. Think about the lives, more lives that could be saved if everyone that could would donate. There is no substitute for blood. If the blood banks don't have blood, then people aren't able to be treated. So it's important that donors donate. Therefore, there is blood, because without it, the blood banks would be obsolete. Since we have discussed a little bit about how it helps others, we're going to discuss how it helps you. The first thing is, a lot of people don't know that you really have a lot of excess iron in your blood. However, when you donate blood, it gets rid of some of the excess, and it was proven in a study that people who donate their blood are 88% less likely to have a heart attack, because heart attacks have been related to high iron levels. Also, giving blood, when you give blood, you get a mini physical, and this checks your blood pressure, your hemoglobin, your body temperature, as well as your blood. And this is important to know, especially if you have risky behaviors and do not go to the doctor often. When they do a blood test, it'll check for HIV, syphilis, and other things of that nature. When you donate blood, you also will learn your blood type, which is very important in an emergency because they need to know right then, and if you don't know it, it could be possibly fatal. If you go donate and you find out that you have O negative blood, it can be used for almost any patient that has other types of blood. But the thing is, there's normally a short supply of it because not enough people donate. AB positive blood, you can use the plasma from it for almost anyone besides AB blood. So it's a great thing, but it also is normally in short supply. So it's important to go donate and find out, because you're not only helping yourself, but you're also helping others. Now, I'm going to talk about some concerns in the process. A lot of people say they don't donate blood because they either don't weigh enough or they're scared they're going to faint. However, studies have shown that most adults are able to donate because they weigh enough. And Fainting does happen, but it's not a very big occurrence. It normally is because of something that happened, like they didn't eat before, or just something very strange. It's not a normal occurrence. So if you go get blood, you're most likely not going to pass out. And when you go in, you need to have your ID, and you'll sign a paper, some papers. Um, Then they're going to do the mini physical, which we talked about above. And once you've been cleared with all of that, they're going to take you back and sit you in a chair. And then the nurse is going to look in your arm. And normally right here is where they're going to clean and then stick the needle in. And that's a big concern. People are like scared about the needles and whatnot. It is 100% new, sanitized, straight out of the package. No one else has used it, and it's strictly just going to be used on you. And then they take a pint of blood, and after that, they pull out and dispose of that and mark your stuff on your blood. They put a band-aid on you, wrap it up, and you're good to go. It's that simple. And if you donate often, you can save so many lives. But just doing it once, like I said, you can save 3 lives. So I hope that you'll go donate.